Now let's talk about troubleshooting. The great thing is the Thermocore 1200 is the easiest to use and the most intuitive infuser on the market. That makes it very easy to recover from any challenges that may arise during a case. But let's talk about some potential areas that you may have to deal with during the infusion. Number one, air in the patient line. Our system uses a unique active air removal technology that is the most efficient on the market. And it works very effectively at very high flow rates and at low flow rates. That greatly minimizes the chance that you'll ever have air into the patient line from the cassette. We also have 4 air sensors, so we've got a lot of redundancy built in to ensure patient safety. However, due to the nature of warm fluids on any system, you may have some outgassing in the patient line. What this does, and how you'll see that, is you'll see that small bubbles start to collect. That's due to the nature of having warm fluids in the patient line itself. We made it easy to remove those. We include a swabbable port on every patient line that allows you to tap the small bubbles as they collect into larger bubbles toward the swabbable port and simply remove them with a syringe. The next area we'd like to talk about is patient line blocked errors. Now with this system, we've got the most advanced pressure control system available with multiple pressure sensors that are constantly monitoring pressure in the patient line and reducing flow rate to stay under your designated pressure cap. With that, though, there are some factors that may cause a patient line blocked error if you're not cognizant of them. Although you can use the system with any size catheter, it's more susceptible with smaller catheters. That is because they're much more easily blocked due to being falling against the side of the vein. Also, it's more challenging with obese patients, so you have to ensure that your catheter is well positioned in order to get an effective flow rate and not to have that patient line blocked error. The first thing you want to look at when you do get that type of error is your catheter positioning. The next thing I'd like to talk about is the tubing and the placement of tubing in the door. As you could see, and as we talked about, our system is very easy to set up and can be set up very quickly. But one thing you want to be aware of is that the tubing in the roller pump door is pushed completely in as you're doing your setup. That minimizes the chance that the tubing could become nicked and cause a leak during the case. Typically, if you do see a leak during the case, it's a rare occurrence, but it's usually due to that roller pump tubing being nicked as you put it on the cassette. So something to be cognizant of as you're setting up the equipment. The next thing is the warming capability of the unit. Our system warms effectively at all flow rates. However, during a long case, you may see the temperature drop. That's due to the nature of the fluid sitting in front of the temperature sensor for long periods of time as you're very slowly infusing. Our system offers the most accurate temperature reading on the market because we give you the temperature reading as the fluid is exiting the cassette. So that's giving you the most accurate reading, but it's also going to be the most effective affected by drops in the patient line as the fluid sits there for long periods of time. And you'll see your temperature will rise up to that target as you're bolusing and running at normal to high flow rates, but it will drop at those very low flow rates. The next thing I'd like to talk about is preventing spills with the unit and preventing damage to the unit during spills.